Hi, my name is Irene Ramos and I chose the topic of albuterol as my ergogenic aid. So albuterol is a bronchodilator that relaxes the muscles in the airways and increase airflow through the lungs. Its primary purpose is to treat bronchospasms with people who have reversible obstructive airway disease. Also, its other purpose that it serves is to prevent exercise-induced bronchospasms. But it has also been shown to be used for other purposes other than medical usage. More specifically, albuterol is a short-term beta-2 agonist that mainly affects the muscles in the lungs, being your bronchi and your bronchioles. So what will happen is the lungs will get irritated to the point where the bands of muscle surrounding the airways will start to tighten and constrict and decrease airflow. In this example, the individual right here is inhaling the albuterol substance, and it's going to travel through and it's going to relax the smooth muscles in order to increase the airway to allow oxygen to flow through. In this case, you can see that this is a normal airway. When the asthmatic individual has an asthma attack, you can see that the smooth muscles has constricted the airway, making it difficult for them to breathe. Now, the non-asthmatic endurance athletes have used albuterol for other reasons. In this case, they will inhale the albuterol substance to the point that it's going to enhance or increase their airway passage, allowing greater amounts of oxygen to flow through. So the endurance athletes, such as the runners, the cyclists, and the swimmers, really like the short-term beta-2 agonist because it works very quickly, within 3 to 5 minutes, and it's going to last for about 4 to 6 hours. Therefore, it's going to enhance their performance during competition. The research wanted to see the potential ergogenic effects of therapeutic inhaled salbutamol doses in endurance athletes. 11 healthy non-asthmatic male athletes with high aerobic capacities in a double-blinded randomized crossover study and were administered 200 and 800 micrograms of salbutamol and a placebo by inhalation before a quadriceps fatigue test. They performed 10 sets intermittent isometric contractions starting at 20% of maximum voluntary contraction, or MVC, with 10% increase until exhaustion. Femoral nerve magnetic stimulation evaluated MVC during and after neuromuscular fatigue after each set and after 10 and 30 minutes of recovery. Results showed inhaled beta-2 agonists did not lead to enhanced strength, activation, or fatigability in endurance-trained men, but reveal an increase in muscle endurance. So now we're going to talk about the side effects of albuterol and when it's overly used. So meet my friend Bobby here. Poor Bobby is showing all the negative symptoms when albuterol is abused. So albuterol mainly affects the muscles of the heart as well as the skeletal muscles. So for the heart, it has been shown to make faster heartbeats as well as palpitations, which are fluttering feelings in the chest, as well as angina, which is chest pain. Down here, it has also been shown to negatively affect the hands, the legs, and the feet, causing cramping, as well as shakiness, headaches, dizziness, and nausea. It has also been shown that albuterol, when overly inhaled, to coat the lips of the mouth and be absorbed rather than inhaled. Albuterol is the generic name. Some of the common brand names are salbuterol, Ventolin, and Asmazole. Administration could be done by inhalation, tablets, and liquid form for a nebulizer. The recommended dosages are as followed. According to US ADA, inhaled beta-2 agonists are prohibited and require therapeutic use exemption, or TUE, except albuterol dosages under 16 micrograms per 24 hours. The dosage of albuterol may be used in sport without a TUE may translate into a wide range of puffs. If you need to take more than the non-prohibited dosage, you must apply for a TUE. Use of oral beta-2 agonists is prohibited even if you have a TUE for the same inhaled beta-2 agonist. But if your doctor prescribes an oral beta-2 agonist, it is required to submit a TUE. Lastly, the presence of albuterol in urine in excess of 1,000 grams per milliliters is presumed not to be an intended therapeutic use and may be considered as an adverse analytic finding.